So, welcome to part 2 of a very beautiful podcast. We spoke about how Girish Krishnamurthy, who's also the CEO and MD of Tata MD, this is a beautiful person who's saying, you know what, I have multiple lives, but I have an umbrella which really focuses on humanity overall and not about what I do at work and what I do in personal life. And when I spoke to Girish that how as a human-centered leadership person, he brings it forward into his daily life, that's why we thought it's important to have him in the second series of this podcast.
My second act is I'm no longer consider myself capital market, profits. I can really create an impact and serve large amount of people. In urban India, we have to solve the chronic disease problem. In rural India, we have to solve the
So, welcome to part 2 of a very beautiful podcast that we started with Girish last time. We spoke about how Girish Krishnamurthy, who's also the CEO and MD of Tata MD, has a very beautiful personal side of him. Normally, we are only leading one life, which is our work life, and then we have a life.
Thank you for that, and I also enjoyed the last podcast, and then I also had a lot of people calling me and
That's
talking
wonderful.
to me,
Wonderful.
and so that is more on the spiritual side of my life. And as you rightly said, this time probably we can focus on what we do on the professional side.
So I say from systems to spirituality, or from spirituality to systems, and from devotion to diagnostics. You know, that's how I describe it. And I say that how beautifully that you have led your life in a very, I would say, conscious manner. And we were having a chat just before we started the podcast that, you know, you seem so elevated. You seem so like, you know, person who's evolved, and not all of us are in that space. So I want to start with, of course, going back again to blend your spirituality into the work. How did you really become so evolved? Is it like, you know, just when you encountered spirituality to enter your life, or was there some pieces of it you still felt before? How was it for you?
So I don't think, first of all, whatever happened to me, it is not me. So I don't think I evolved and matured in a conscious manner. This is what I'm trying to do, type of stuff. I feel it all happened by itself for a reason, and mostly I dedicate and assume it all happened because of the grace of God and the kind of teachers and gurus I came across in my life. Their abundance of grace on me and taken care of this. That's the way I see it.
Okay.
I still feel, I always feel that I'm doing very small percentage of what they have given to me. And very small percentage. If you say something is unfulfilled or what is not satisfied in my life is, I'm not living a life, the kind of life my gurus and my teachers would have expected me to perform. And I'm trying my best in a daily basis to see how I can better it. So, but to coming back to your thought process systems and all of it. See, like everyone, I started my career, I was one of the early technology software development type of a person from India, and I really never wanted to go out of India. So I tried my best to be a technology oriented, software oriented entrepreneur in India. I was reasonably successful. But there was a point in the early 90s, I realized while all these skills and capabilities given to me, and which I am not able to put into fully use, so that is the main reason, and I chose to leave India and go to the US.
Okay.
And my experience in the United States is, during that period, was amazing. So I've always been a senior leader, growth CEO type of a role where I take small companies of $25-30 million company, grow them to a big. So I used to call myself as a growth CEO at that point of time.
And it is also something that, of course, the world needs it, but at the same time, what your work now is all about, blending it together with making the world a better place in many ways, and your transition into Tata MD. My question then is very, very pertinent to say that how does a man with so much logic and so much technology behind him fell into taking up a role with, an organization which was like literally about making sure that people feel better and, the world shapes up in a much healthier way?
That's a very interesting question, Archana. See, it happened again. And see, I will just narrate the story how it happened.
Okay.
It was like an accident, it happened. See, I joined Tata Consultancy Services.
You're a man of many accidents, by the way.
Okay, thank you. So,
I'd say that.
So I joined Tata Consultancy Services to more from the innovation space and designing new innovative businesses and business models and products. That was my role. And today, the Mr. N. Chandrasekharan, Tata Group Chairman, Executive Chairman, used to be the CEO of Tata Consultancy Services. I used to report to him.
Okay.
So I distinctly remember one day, so from the strategy perspective, he used to meet me regularly once in a month and spend about half an hour, 45 minutes to discuss exactly what can be done better next in the innovation space. So he gave me an assignment saying that to identify one particular sector, which is going to have a tremendous impact because of digital technology. See, today we talk about AI, other digital technology. So those days, 2012, 2013 time frame, he asked me a question to go and do a analysis and come back which sector TCS can focus, which will have a lot of potential 10 years from that time on technology impact, and it will have a large space to grow because of technology. I said, in my own childish way, I reacted very fast, saying that I don't need to do analysis, and it is going to be healthcare and education. Then he asked me why it is healthcare. And I had done some reading and I had some views about healthcare, but very minimal. And I explained to him, these are all the reasons I feel we don't need to analyze it. It is healthcare. We can focus on healthcare. He agreed immediately because he had a great vision immediately to see that, okay, healthcare is a space where technology is going to create a big impact.
So wonderful.
So he asked me, okay, now that you are saying this, who can run this part of Tata Consultancy Services? And since I never had any healthcare background, I told him that I was part of the Sathya Sai Central Trust. We created a big hospital in Bangalore. I was a very small part of that, creating that hospital I played. So I said, other than that, I don't know anything about healthcare. Then he said, given the type of complication and challenges you are saying, you may be the better person, learn it and do it.
Wow.
So he had all the confidence to tell me that, okay, you run this.
Wow.
That is the way my healthcare journey started. And like everyone, I started with healthcare, approaching how to convert this into a big tech-oriented businesses. Even today, worldwide, whether it is the Western developed world like United States, France, Germany, Italy, and all of these countries, or countries like African continents, countries in African continent, India, and all of these places, healthcare is continued to be a challenge. And I asked the question, why? If it is a sector which is, why as a human being we are unable to solve this problem? When I started looking this health sector in that angle, the kind of complications and challenges which we have created on our own is really very deep and complicated. So then I made a resolution in my mind that this area, this sector is not just require system, it require a systemic change.
Yeah, that's a good one.
So I made a commitment and to develop a model and a philosophy and a mechanism which can certainly make this change.
Great. So
And
can I pause you here? I just want to ask you, from a person who had never done something like this before to somebody who was now leading it, thanks to the trust, of course, which came from the Tata Group for you. How does a person feel in that space? What did you feel at that time? Was it something that you were ready to take? Did you have to unlearn a lot of things? Did you have to promise yourself a few things to take it forward in a certain way? What transition did you go through as a leader, as a person?
so what really has been driving me?
Yeah.
See, I feel even in healthcare, whatever I have done or we have done as a Tata group or as a group as a large with whomever has worked with me, we have not even scratched the surface. We have not even started. But whatever work which we can do in this space can lead into a huge impact for years to come, minimum for another 100 years. That is the level of change this requires. The health system worldwide assumes one fundamental philosophy, which is if somebody falls sick, they will find the doctor and the care. But that is not true, because 2/3 of the world still have a huge problem in access to healthcare. In a developed world, if you have access, the affordability and availability of care is very, very expensive.
That is true.
Now, so anyway, we have a huge complication created in this space.
So I want to know that what is the crux or the main challenges that Tata MD is trying to solve?
Okay, so see, if you look at healthcare per se worldwide, I would define it has got few fundamental design issues, which is the care which we are getting today, which is episodic in nature. What I say episodic means, one time you fall in sick, and then if you are getting some cold or fever today in India, you might go to a local pharmacy and take a medicine.
Right.
Or you will go to a local clinic or speak to your one of the friend doctor or your relative and take some medicine. If you have some other problem, you will go to a medium sized clinic or you will go to an hospital.
Right.
But you just one episode to another episode, you will come back. This is one problem. Second problem, the care which we are giving, which is highly disjointed. One is an episodic in nature, another is disjointed.
And what do you mean by that? Because, I mean, like you said, I'm falling ill and I go to either a medical store or depending on the intervention. So what do you exactly mean by this now?
So now what happens when it is disjointed means you are falling sick and you go to, if it is a problem in your heart, you will go to a cardiologist directly.
Right.
Or you will go to a specialist, and every hospital runs like a primary care, they call us an outpatient department, and pretty much hospital only gives you the care, and so nothing is connected. It is not connected to through institutions. Internally also it is all disconnected and disjointed.
Okay, got it.
So this is coming from the technology world, you might think that, but nothing is going on unison. It is all not synchronized. The third one, which is very big and which I call as payer driven and provider centric.
Okay.
See, in the Western world, the payers are the insurance companies. In some of the countries, government pays for the care. In some of the countries, there are private insurance, they pay for the care.
Right.
Even in India, there are a lot of private insurance, we pay for the hospitalization when you get admitted in the hospital.
Yes.
Now, how do these institutions, that insurance companies, they pay? There are certain guidelines created by the medical council, like in the Medical Council of India, like this. You have various standard organization in the world, like they know how, they give the treatment protocol and everything. At the end of the day, the payers, they pay based on certain process you followed. That process is what is a treatment. So if you look at it, the way a treatment has to be provided to a patient is defined, the rules are defined by the payment companies.
Right.
So this is the first problem. Second problem is, it is a provider centric. That means the provider here is a doctor or an hospital. They are going to define the process and the method on which they are going to give the care, which is best suited for them.
Right.
Not from the patient perspective. So it is not patient centric, it is provider centric. The care is provisioned. So the doctor and hospital in a Western world has to think, okay, what is the easiest and best way I can give the care to this person from my perspective? How do I ensure that I get paid when I provide this care? Right. So this is a philosophical problem, and it has got a lot of underneath connotation. And also last 50-60 years, the medical science, they have developed very fast. There is a lot of great development has happened from the medical science perspective, lot of innovation perspective. Most of this innovation, two important point here. One is, most of these medical sciences have assumed the innovation area for last 25, 30, 40 years is when a patient is with a doctor. But 2/3 of the world's problem is how to get to the right doctor.
Of course. I mean, that's a really big problem.
So then the second issue, there is no innovation there. There is no technology, innovation, methodology developed how to take a patient to the right doctor in a right time very quickly, easily.
Right.
And then the next one is, because we have created evidence based model, right? For everything we have a diagnostic test, report, laboratories. So evidence based medicine is fantastic. So but the evidence based medicine came with specialization. So the specialist and the specialized equipments are there only in the big hospitals. So slowly but steadily what happened, care only in the hospital model has evolved.
Right.
So now if you combine all this problem together, it becomes a very complicated space. So this is the situation of the health paradigm in the world.
Right.
The value system of Tata Group is already set, and we come up with a lot of values in making our business successful.
Sure.
So there is a concerted effort in the group. When anybody joins, we all go through that rigor and the training to understand the core values of the group which we make. Now that is always there. This is with the ethics and all of that. But specific to healthcare, what are the values I bring in to this real work every day?
Yeah.
See, the number one is the ecosystem is already created over a period of hundreds of years. Doctors are trained in the med schools in one mechanism, and they have been trained and in a method to treat. The healthcare delivery organization like nursing homes and hospitals and clinics, they all have a set model, and there are certain procedures. This is one side. On the other side, there is a huge medical and treatment protocol, care pathways and methodologies which are all set by the medical science.
Sure.
On the third side, which is the care delivery mechanism and the cost, the procedure associated with that. So now three already set place, and you have to change it. To bring these principles of continuous, connected, proactive care, you have to change all the three. It is not easy. You cannot change it by creating a company with a new process and everything, because your patients has to consume your services.
Sure.
They are used to get services in one method. Today, most of the patient, what they expect is they have to go to a hospital or a doctor and they'll give a prescription. You bring this prescription, go to a pharmacy and take a medicine, or take that prescription, go to a laboratory and do the test. This is all the way everybody knows. If you need to change all of this, and like me going and talking to a endocrinologist, which I am not a doctor, even though since I am there in the healthcare field, a lot of people call me Dr. Girish thinking that I am a medical doctor, but I am not. So, if you are going to go and speak to a doctor and tell that, the way you are treating the patient, you have to change, it's not going to happen. Because he is the person who is trained and specialist on it. And you are going to go and tell the various delivery organizations. So, all the stakeholders are not going to agree what you are going to say, even though what you are saying is right thing or good things.
What are some values that you're bringing in from your personal space, who you truly are, and then how do you become this human-centered leader?
So, there are 3 values on my job every day I follow. One is I bring in love and compassion to work with all the different stakeholders.
Beautiful.
And extraordinary amount of perseverance and energy, which is very important, because if you are going to change anything, you have to act like a change agent first. You should believe what you can change.
So true.
So, I bring in a strong amount of conviction, love and compassion to make this place better.
Right.
So, that is the value I bring in. This I work with all the stakeholders,
Sure.
the deep medical professionals like doctors and all the institutions and the patients. All of them has to change. So, these 3 values become instrument to change.
Great. So now tell me, you mentioned that, we are living in a world where we don't know if we fall ill, what is the next step? And here Tata MD is bringing a solution under one umbrella where right from preventive to curative, everything is available. So how do you match what I really need right now and to which doctor or which kind of intervention do I really need? What is the process looking like?
Okay, so we divide this into 3 simple steps.
Okay.
Most of the treatment, not necessarily, see there are in healthcare there are 2 types of diseases you can say, acute diseases and chronic diseases.
Got it.
When you fall sick. The acute means you go once, get treated, how much ever complicated, you get treated and come back. It could be like you have a fever and you got treated, or you have you had a bypass surgery and come back. It's a one episode you complete. Chronic diseases is closely you can say like a lifestyle diseases.
Right.
Like a diabetes, hypertension, obesity and all of this requires a continuously, it is going to be there and you have to constantly treat them. So, you divide that in a big block, chronic diseases and acute diseases. See, for example, I will give you an example. In New York City, I was told, and the whole transportation and people commute was happening with horses. The horse created pollution was so high and people were falling sick. When automobile came in and the whole transportation system was threatened. And so, when the industrial revolution happened, there is a huge agriculture economy got threatened. But we all changed over a period and so many farmers, they found what they need to do. Similarly, AI is appearing because it's a big infrastructure change, the way the internet, the way the semiconductor was invented. It's a big infrastructure change and this is a change is a new normal. And we don't need to feel threatened and we will all learn how to live in this world, and of course AI is going to make every person's life change in very fast manner.
So tell me something, that is this because of understanding how AI can enable today healthcare? You're also able to do work in diverse communities, right from rural all the way to urban. and in a way understand the needs, like you said, collection of data, understanding what's required at what spaces, what is required in the underprivileged communities, all the way to the most ultra modern cities like Bangalore. I can see that you're very much prevalent in doing work in Karnataka, though you've experimented in different states. What stops you from really expanding today to every nook and corner of India, especially coming from the Tata backing, which, because that's the strongest, which can take it to all over India?
So, the rural India, we have developed a primary care model in Karnataka in a Kolar district. And currently we have expanded that to the whole state of Andhra. We are working with the Andhra Pradesh government for the whole state of Andhra. We are in the process of working with them. Similarly, in certain areas in Assam we are working. And we have a plan to roll it out nationwide.
Okay.
And it's a question of time, because there are several stakeholders, not that we want to do tomorrow, because it's a very complicated problem. It takes time. And it has got policy implications, and it has got process to be done, and then there is a cost implications. So, all of that has to fall in line, and we are working very hard and focused to see how we can take it nationwide.
Got it.
But we are, as I told you, we are in a very early stage of this game. We have a solution, we have proved, and it is working, and we are confident. We have been maturing this, because doing it for a pilot for 500 people is easy. But making it work for 5 million people requires a lot of stability and rigor and rhythm. That is what we are maturing every day.
If you had to really say that this has been the success of Tata MD so far, which you want to now prototype and take it forward, what is that one success that you feel already?
There is a method we call Digital Nerve Center, which we call as DANC, and DANC.AI and DANC, which is a Digital Nerve Center is a model which has an ability to include the last person in every village to get the best health care.
Oh, wonderful.
So, if one thing is, if I say a success of Tata MD model, see, if today, Archana, if somebody is of your nature, if they are going to go to an hospital and get treated, and you might go to the hospital, but still you expect some doctor or somebody like your big brother to help you to maneuver the system to get a quality care. And you will have the second opinion, third opinion, all this thought process. Whereas in Tata MD model, that big brother is replaced with our model, so that every person gets a consistent high quality care available at his or her doorsteps at a village level, is this model provides. So, we are extremely proud that we are able to prove it at scale.
So, what are you doing to make it affordable? Because healthcare honestly can vary from simple diagnostics tests to now having so many variations of even having a certain kind of an infrastructure available to you. Whether you call it scanners, machines, x-rays, like MRIs, technology is moving so fast. And then you feel that anything that probably was before was turning obsolete. So, right infrastructure also comes with a price. So, how are you trying to make it affordable?
See, volume makes all the difference. So, today what is happening is, you are very small amount of our population only gets treated. I will give an example in cancer.
Okay.
So, I think we treat close to about 1 million cancers every year as a country. That is the capacity on which we are treating. The cancer is a disease where only if you know you have a cancer, then you will start treating. That means screening is what makes a difference. So, we screen less, so we treat less, but the disease burden may be very high.
Yes.
Now, if you are able to identify cancer very early for a larger population, automatically the care will come down.
Yeah.
This is point 1. Point 2, we try to provide care only in the hospital model. So, if you go and put a CT scan or an MRI which you mentioned, which is an expensive machine, into an hospital, then hospital requires certain number of people every day to be scanned, right? Then automatically it becomes a business metrics to run over.
Yes, yes.
Whereas if you are able to decentralize it, while 100 people every day getting scanned in one hospital, there is another 100,000 people are waiting to get scanned somewhere.
So true.
We are not able to bring. Now, the only way you can make healthcare affordable, only if you make it equitable. The equitable possible only if you decentralize it. This is point 1. Another point is, anything and everything in healthcare has to be done and decided by a specialist doctor. Let's say a cancer doctor who is called oncologist. An oncologist and an oncology surgeon in our study shows that 52% of his time he or her spends on doing non-clinical activity. About 35% of the time they spend on administrative activity.
Yeah.
Now, what we have done is, this is to, our chairman wrote a book called Digital Nation. It's a concept called digital.
Yes.
We demystified what the doctors do and what are the specialist activity only he can do, make him to do, and other than that, booking an appointment, booking an, getting the operation theatre ready,
Right.
preparing notes, like this there are a lot of administrative or a semi-clinical activity. Somebody else like a BSc graduate or somebody else with clinical experience, certify them, give them a technology to do consistently. We reduce the doctor's time, and doctor's focuses only on the specialist work. That means he can treat more patients. So, we unleash capacity by bringing efficiency.
Got it.
So, by doing all these measures, we bring the cost down. So, to summarize it, volume is one game, the other one is efficiency is another game. These two will bring down the cost, and that is possible only with technology, and given if you are able to leverage AI properly, you are going to see a big difference.
So how are you making sure that AI is also an enabler in the rural sections of the society? Because there still it's not penetrating as much, and second, probably education is playing also a major role in making them aware.
So, that's all assumption. It is not true.
Okay.
The reason it is not true is, for a consumer, whether it is coming from AI or it is coming from directly a human person or through some other method, doesn't matter. As long as you are able to make the consumer to consume the most easiest way, they are going to consume it. So, why our street vendor is able to consume UPI is it's very easy.
Yeah, it's made.
So, AI as a technology infrastructure is going to make the consumption easy. So, the end consumer is never going to feel that it is AI is doing. So, to be a consumer, you don't need to be AI savvy, you need to consume.
Yeah, you're right. So, what are the next steps for Tata MD right now?
So, we are working on two big initiatives.
Okay.
One is working on the rural healthcare.
Right.
And we are working with, we have developed the method and approach everything and continue to improve it. In the AI area, we are bringing more and more AI into our model. So, that is one area of focus. So, as we see as many states and as many places in rural India, we want to make primary care happen. Similarly, on the urban India, we have specialized about 9 chronic diseases right now, the most important chronic diseases, like starting from diabetes to rheumatology, dermatology. On all of these areas, you don't need to go to hospital. So, where we are developing or we are in the process of maturing better and better, we are working on it, and this also will have an impact on rural side. So these are the two big areas Tata MD is currently working in maturing this model, and we will also focusing on developing a scale on within India, and I also feel what we have developed is very pertinent for the global audience. So this is one area probably in healthcare, whatever we have developed will also become important for the global requirement.
That's
So
amazing.
this is what we are working on, and as I told you, we are in a very early stage.
So we do need more leaders like you. I want to know from you what keeps you so grounded, because every time that I've met you, your simplicity, your pure heart, and your focus on creating a better world is something that really touches me. So what keeps you this person at all times?
It comes out of a few things. I feel it is the experience what you have experienced in your life. By seeing several people in your life, how they have grown, what happened to them, both in a positive and negative way. So the humility is no longer is a virtue, it's a necessity. If you need to be happy, humility is the first criteria. And making it being simple and humble is for your own good. It is not for anybody else. If you want to be happy, these are the two things. You simplify your own life, don't complicate, and then be humble for everybody, because always I feel the next person to me is better than me in every part of life. So if I see you, then I really enjoy being with you, because you are better in so many things. I learn by being with you. So that automatically brings me that, okay, you are my teacher whenever I meet you. So anybody who I meet you, I think that the universe is my teacher.
So beautiful.
So that's a thought I carry every day morning. So whomever I feel like, I think they are teaching me something every day.
So Girish, Second Act focuses a lot on women. And I say this from my own personal life, that sometimes we just take ourselves for granted. And so is women's health. There is a lot of things that we don't speak about, we don't even have an idea about. We just go with the flow because, somewhere in our life, somebody has told us, ye aise hi hota hai, ya, this is how it is done. So we don't even question it. But now there's more awareness, there are more conversations. And I want to dedicate one series with you, the next one probably, which is focusing on women and their health. And if that's okay for you, because I know that Tata MD will definitely be centering around how women can really look after themselves.
Absolutely, Archana. See, the women health in today's world, which are not true about 30, 40 years before in India. Lot of our young women between the age of 18 to 40, in our study shows the PCOS and PCOD is really affecting their life.
Absolutely.
And then when you take little older women, the other conditions like menopause and other hormonal changes is creating a huge impact. It is creating not only their physical well-being, their emotional well-being and other things, its impact is huge. And we have done some clinical work and medical work on this space, but I feel women health has to be looked at very differently. And certainly we will do a podcast and I can share my thoughts.
Yes.
But as a country and as a world, a better place, we need to think very importantly women health very differently. And it is very critical. And certainly I'm glad you brought it up. And I will also do some preparation.
Yes.
And I won't say that I am fully ready, I am aware of this. I will discuss with my colleagues, my clinical friends and other people. I have few thoughts. I'll put together when I'm ready, I'll tell you, then we can do a podcast.
Absolutely. No, but like I was on a lighter note, I want to end this when you said that, all your financial decisions are still taken by your wife, and how you get a little bit of a pocket money from her every month. It all starts from there. Making it an equitable world, handing over the baton to your, the women in the house. Okay, so thank you for listening. I hope that this was yet another one which really opened possibilities of thinking about how health can be shaped up. And there are companies like Tata MD and of course people like Girish who are forefronting it, and that's what makes this space truly special as well, because there's more care and it comes from the values that one holds in their personal life. So absolutely amazing to do another podcast with you, Girish, and I'm looking forward to this only women's
So
podcast with you.
I'm also looking forward to it. Thank you.
Yes, thank you very much.